Imagine you're running a business, right? And um, on paper, it looks like an absolute juggernaut.
Oh, yeah. A total powerhouse.
Exactly. You have customers coming through the doors 24 hours a day, 7 days a week. There's like no off season.
Which is rare for any
Right.
business.
And in fact, your services are so essential that people's lives actually depend on them.
Yeah, the stakes are incredibly high.
So because of this nonstop demand, your enterprise generates billions of dollars in revenue every single year.
Yeah.
You're processing just a staggering volume of transactions.
It's like a dream scenario.
You would think.
Yeah.
But behind closed doors, the financial reality is it's entirely different.
Yay.
You are constantly sweating over the payroll for your staff. You're delaying equipment upgrades. You're operating dangerously close to the red line.
Just kind of wondering if a single bad month might trigger a total financial collapse.
Exactly.
It breaks pretty much every conventional rule of business we're taught.
Yeah.
If the demand is there and you're creating billions in value, that value should naturally translate into financial stability.
You'd assume so.
But in the healthcare industry right now, that translation process is breaking down on a massive scale.
And that's exactly what we're getting into today in this deep dive. We are looking at a highly revealing presentation from a company called ClaimCalc Pro.
Yeah, their data really strips this issue down to the studs.
It does. And the title of the report is Health Systems Don't Have a Cash Problem, They Have a Cash Access Problem.
Which is such an interesting distinction.
Okay, let's unpack this, because that distinction between generating revenue and actually accessing cash seems to be the root of the entire hospital crisis we're seeing today.
It really is.
Our mission here is to figure out why massive, vital institutions are basically starving while surrounded by a feast of their own making.
Well, the foundational premise here requires us to completely decouple the concept of revenue from cash.
Right, they aren't the same thing.
Exactly. In most traditional businesses, those two things happen almost simultaneously.
Like retail.
Right. You buy a cup of coffee, you hand over $5. The coffee shop generates $5 of revenue and immediately deposits $5 of cash.
Super simple.
But when a massive health system treats a patient, say, they perform a complex spinal surgery and manage a 2-week ICU recovery, they generate a massive amount of revenue.
Huge.
They provided an incredibly high-value service, they incurred all the expenses of providing it, and they're legally owed money for it.
Yeah, billions of dollars of this earned revenue are generated across these systems annually.
But as the ClaimCalc ProSource points out, generating the revenue is only step one. Accessing it is a completely separate, highly volatile operational hurdle.
It kind of reminds me of the reality of being like an independent contractor or a freelancer.
Oh, that's a good comparison.
Right. You can land a massive client, do months of grueling work, and submit an invoice for $50,000.
And celebrate, right.
Yeah. On paper, your business generated $50,000 of revenue this quarter. You feel like you hit the lottery.
But the ticket is locked in a safe.
Exactly.
Yeah.
It's in a titanium safe that you don't have the combination to. Because if that client has a 90-day payment window, or if their accounts payable department disputes the format of your invoice and kicks it back, your bank account is still empty.
You can't use earned revenue to buy groceries?
No, you definitely can't pay your mortgage with a pending invoice. Your wealth is entirely theoretical until that specific bureaucratic friction is resolved and the cash actually hits your account.
What's fascinating here is how the source material visualizes this problem at an institutional scale.
Oh, the funnel visual.
Yeah, they use this striking image of a massive funnel positioned over a hospital. You see billions of dollars pouring out of the sky, representing the sheer volume of care being delivered.
All that revenue being generated.
Right. But right at the bottom of the funnel, right before that money actually enters the hospital doors, the spout is severely constricted.
The money's just bottlenecking.
Exactly. The hospital staff is doing the grueling work. They're staffing the emergency rooms at 3 a.m., running the diagnostic labs, saving lives.
And the balance sheets reflect astronomical earnings.
But the flow of actual liquid cash is moving at a trickle.
Which brings us to the ticking clock. Because if you're a multi-billion-dollar health system, your daily overhead is just astronomical.
Oh, absolutely.
You have thousands of highly specialized employees. You have expensive pharmaceutical inventories that actually expire. You have massive facilities to power.
And if that cash flow is constricted, you are burning through your reserves fast.
Exactly. And to understand how dangerous this is, we really have to look at the primary metric the industry uses to measure survival.
In the healthcare financial world, that metric is called days cash on hand.
Right.
The source defines this very explicitly. It is literally a survival timer.
Like a literal countdown clock.
Literally. If a hospital stopped collecting any new cash today, if that funnel completely clogged, how many days could they continue to operate normally?
How many days could they meet payroll and buy medical supplies using only the liquid cash they currently have sitting in their accounts?
And the presentation breaks down the danger zones for this survival metric.
Given that we're talking about institutions that bring in billions of dollars, I'd assume they have massive war chests.
You'd think so, but the numbers are incredibly tight. They are shockingly low.
Yeah.
According to the ClaimCalc Pro data, if a health system drops below 100 days of cash on hand, they enter a state categorized as pressure.
Meaning they have less than 3 months of runway.
Right. Which means leadership has to start making difficult operational compromises immediately.
That's stressful.
But it gets worse. If they drop below 50 days of cash on hand, they enter a state of severe risk.
Wow. Barely a month and a half.
Barely a month and a half of survival time for an institution that an entire community relies on.
That's terrifying.
And the source includes a very stark reality check right below that metric dial. It plainly states, this is happening now.
So this isn't some theoretical modeling for a future economic downturn.
No. Major health systems are operating in that sub-50-day risk zone today.
Okay, wait, I have to challenge this premise a bit.
Sure.
Because the source also shows a massive disparity within the industry itself. Uses this split-screen visual.
Right, the comparison.
On one side, you have a thriving system, and the text says some hospitals are sitting comfortably with over 400 days of cash on hand.
They have more than a year of buffer.
Exactly.
Yeah.
And on the other side, you have the systems operating in that severe risk zone with less than 50 days.
Yeah.
If these hospitals are in the exact same industry, dealing with the exact same healthcare system, what changed? Why is there such a massive, terrifying gap between the haves and the have-nots?
It's a huge gap.
Right, because if a hospital is down to 49 days of cash, my immediate instinct is that it's just a badly managed business.
Like they expanded too aggressively.
Yeah, maybe they built new wings they couldn't afford. Or maybe they just aren't getting enough patients through the doors to cover their fixed costs. Are we sure this massive gap isn't just a basic supply and demand issue?
This raises an important question, and the answer is really the crux of the entire analysis.
Okay.
When we see a gap that wide, 400 days of survival time versus 50 days, our instinct is always to look at the top line.
We assume the failing hospital just needs more foot traffic.
Or more profitable elective surgeries, or a better marketing department.
Right.
But the ClaimCalc Pro presentation makes it unequivocally clear that this disparity is not about patient volume.
Really?
Yeah. Both the 400-day hospital and the 50-day hospital are full. The beds are occupied. The difference has absolutely nothing to do with demand.
Wow.
It is entirely about operational mechanics. The hospitals in the risk zone aren't failing because they lack patients. They're failing because their internal machinery for converting that patient care into realized cash is fundamentally broken.
Here's where it gets really interesting. To understand how that machinery breaks down, we have to look at the internal machinery of the hospital to see exactly where the money is getting stuck.
And the presentation maps out the journey of a single medical claim.
It's essentially a 4-step maze, right?
Yes. And navigating this maze is the only way the hospital actually gets paid.
Step 1 is care delivered.
The physician diagnoses the issue, performs the procedure, the value is created, and the revenue is technically earned.
Then step 2 is claim submitted.
Right. The hospital translates that medical care into a highly specific set of billing codes and sends the invoice to the insurance company or to Medicare.
And that is exactly where the process derails for the hospitals that are bleeding cash.
Because step 3 in this journey is denied or delayed.
The payer, basically the insurance company, pushes back on the claim.
And that leads directly to step 4, cash stuck.
Yeah. The hospital has already incurred the massive expense of providing the care, but the reimbursement they're owed is now locked in a bureaucratic holding pattern.
The source uses a very specific visual for this, an image of a heavy iron chain snapping apart to illustrate the broken chain of the revenue cycle.
It lists 4 exact points of failure where this money gets trapped.
The exact 4 points.
And honestly, looking at these 4 points, it feels less like a simple administrative error and more like an adversarial obstacle course.
It is an incredibly complex system, and understanding the mechanics of these 4 failures is crucial.
So the first point of failure is denials.
Yes. This is when an insurance company flat out refuses to pay the claim.
And this isn't usually